It's my extreme pleasure to welcome our two esteemed guests, Dr. Haber, Dr. Josh Haber, the CEO of Cleveland Clinic, and Rizwan Tufail, Chief Officer of Data and PureHealth. Today we're going to speak about the revolution of artificial intelligence and how healthcare systems, whether it's the industry, whether it's the end users, and whether it's the system itself in the country, revolutionizing. And I can say, coming from the industry, that I have seen innovation in the last 2 years that I haven't seen in the last 20 years. It's mind-blowing and an exciting time to be here. So I hope you enjoy the session with us. So we start with Dr. Haber. Dr. Haber, congratulations. I heard that Cleveland Clinic was just nominated as the smartest hospital in the world. So congratulations for that. I think this is breaking news that came in yesterday.
Thank you.
Dr. Haber, tell us more about the data. How do you integrate artificial intelligence in the hospital itself? How do you see it in the future? I've learned also from you that yesterday you had the first assisted robotic surgery in the hospital with the help of artificial intelligence. So how was that? How was the experience?
Excellent. Thank you, and thank you for having me here today. So data is at the heart of healthcare. And as you said, there was a lot of progressive adaptation of data in healthcare. And there's 3 main areas where we're using data. Patients, the organization, and for the community. When it comes to patient, the most important thing is patient's experience, but quality. And data is now being used to improve and measure quality on a daily basis and to get live feedback on what's going on with patients. And this is the most important thing, right? It's just to get the patients the best care possible. We're also using AI to assist the physicians in their daily tasks. So you talked about the first AI-assisted robotic prostate ablation that was done yesterday, but we've also been using AI to assist with colonoscopies. By using AI-assisted colonoscopies, we were able to improve the detection rate of cancer tumor in the colon by more than 20%. So this is how we can effectively use data, effectively use AI algorithm and models to improve the quality of patients. Data is also used at the organization level to run the hospital, from bad management to staffing to model to predict the demand of the patient that is going to be needed to supply chain and you name it. So data is being used to build dashboard and for all the administrators to be able to run an efficient healthcare system. And on the community level, we've seen it during COVID. We use data to predict surges. And now, it's the beginning of the flu season. So we are using data to start monitoring when the first flu cases are going to happen, when is the surge going to happen, when we should start to vaccinate. So again, data is at the heart of everything we do in healthcare. The fact that we're also able to use data to model and have good AI algorithm is going to be a very big step forward in the next few years.
Great, fascinating. So we talk a lot about personalizing healthcare also, on targeted medicine and the power of data. And how do you see this integrated in your hospital or in the future of healthcare in the coming period of time?
Absolutely. I mean, I've heard from the previous panelists about the importance of data and the importance of clean and accurate data, because we need clean and accurate data to be able to train AI model to give us accurate modeling. To give you a few examples of how we're using accurate data on a daily basis. Sepsis, which is an infection, generalized infection, if it is not treated in a timely fashion, the death rate could be around 50%. By having AI models and predictive models run in the background on every patient in the hospital, we can predict which patient is going to have sepsis just when it's beginning and be able to treat those patients within an hour, which will decrease the death rate from 50% to less than 10%. So this is how you can see how we're using personalized data to monitor those patients in the background and alert the physicians so patients can be treated in a very quick fashion. So this is an example, and I can give you a more futuristic example, digital twins. where we can build, using data, a digital version of a patient, model how the different treatments are going to affect those patients, if they're going to have side effects, or predict if the treatment is going to work, and choose which treatment and personalize this treatment to those patients, just by using a digital version, a digital twin of each patient.
Digital twins, fascinating. I'll get back to that topic, but Rizwan, if you may, tell me more also about the continuum of healthcare and how are you planning that from a integrated body, from a PureHealth perspective. So what is your perspective on what we were speaking about, the digital twins, and how can the industry and HCPs be integrated in that?
Excellent, thank you very much. First of all, thank you for inviting me to be part of this panel. I would tend to completely agree with some of the examples that have been talked about. The sepsis prediction, a number of examples all across the healthcare system as soon as people step into the healthcare system. However, we also know that in terms of determining the health of an individual or health outcomes, the interactions that happen at a healthcare system or in a health setting or in a provider setting are maybe about 20 to 30% of that. A big part of a health outcome of an individual is also factors outside of that. Behavioral factors, socio-economic indicators. So as an integrated healthcare network, one of the unique advantages that we have is for us to look at an individual as an individual, not just as a patient. An individual is a person before they show up in a healthcare setting and need care. That's where sick care starts. But what if, and how can we think about really providing preventative healthcare is where the biggest opportunity is for us. So as an integrated healthcare network, we have been working on the kind of interventions that would allow a person to take care of themselves before they show up in a healthcare setting. Our longevity coach, Pura, is an application that allows an individual to understand their health risks based on their biomarkers, etc., and over time, based on their genetic profile, so that they can take better care of themselves before they show up in a healthcare setting. And then all of the examples that have been talked about in a healthcare setting, absolutely, we're looking at that, we're really excited. I think generally people talk about this concept of precision medicine, and or precision healthcare, and it's really exciting. Let's take a step back and talk about that as well. Generally, people talk about there is a data continuum that feeds this idea of precision healthcare. And on one side of the continuum, imagine a figure 8. And on one side of the continuum is what we would call precision diagnostics. So all of the conversations that were taking place on the panel before around how do we ensure greater reliability of the diagnostics. Now that information then, on the other side of the figure 8, goes into advancing therapeutics. So the pharmaceutical industry takes all of that collected data and develops better therapeutics, develops better treatment protocols, etc. And this loop feeding itself improves health outcomes, is the vision of what people would call precision healthcare. We think that there is maybe a circle before that, and that is empowering individuals to take better care of themselves through data awareness so that we can help them before they come into a healthcare setting. So when we think about digital interventions in a healthcare setting, we're taking a step back. We're thinking about the entire life journey and where we can intervene. So I've talked about the individual life coaching to help with that, etc. And then we also look at the broader community. We've talked about, predicting influenza surges. Those are the kind of interventions that we undertake at a broad ecosystem level to understand what are the health conditions that are emerging and how the health ecosystem can respond to that.
Wow, that's a lot of fascinating news also. So there's a digital coach that would speak to my digital twin in the future, try to treat me from a prevention until the treatment. And speaking about the patient journey and the adoption itself. So we speak about the opportunity, and we spoke a lot about the opportunity and all of this exciting news. What kind of challenges also do you see on the other side, and how do you see that the industry can help prevent and adopt such new innovations, whether in the country or in the region? Dr. Haber, your thoughts?
So every time we want to make a significant, meaningful change, there is barriers and there is challenges. And in fact, this is the fun of it, right? Is to overcome those challenges. The main challenge that we face right now is the accuracy of the data. And without accurate data, we cannot. There's a lot of great ideas and a lot of great models, but if those models are not trained on accurate data, we're not going to get anything meaningful on the other side. What we like to say is, on data, is garbage in, garbage out. We don't want garbage in. We want accurate data, and this is where we need to be very diligent in acquiring accurate data so we can build those models to give us accurate predictive models that can help patients in the future. So where industry can help on the technological side. Usually healthcare lags behind other industries. We can see, for example, cars. We have self-driving cars. Healthcare is much behind. But this also tells us the opportunities that we have. For example, I'm going to talk about my area of medical expertise, which is robotic surgery. By partnering with the robotic company, we were able to provide accurate surgical data to train robotic models to do certain procedures. This is how the partnership between the medical expertise of healthcare system, the industry on the other side, bringing those two together, we can bring meaningful change.
Perfect. And can you shed a little bit of light? We spoke a lot about the power of data, the translation of this data itself. How do you see it from a skills and capabilities perspective in the region in the coming couple of years?
I mean, this region, the leader of this region, the regulator, are very forward-thinking people, which is amazing. The fact that there is a lot of support to technological advances and AI, emphasis on AIs, allow us as a healthcare providers, which is usually a field that is very regulated, to be able to implement things by working with the regulator very closely, to be able to implement things and move the field forward much quicker than any other places in the world. Healthcare is a very regulated business. If you don't have the support, it will take years to make any meaningful change. So I think we're lucky to be here. It's a perfect time to have the support, to have the medical expertise that is here locally, to be able to make a change, not only a local change, but at the world level.
Perfect. Rizwan, can you from your side also share your thoughts on how, as an integrated body, you can help elevate the penetration of these new applications into the region? What's next? What do we see next? And how can we partner from an industry perspective, integrated body and healthcare professionals, to make sure that the patients in this part of the world are receiving first-in-class data, prevention, protection, and at that day, treatment?
Excellent question. So I would echo exactly what has been said. I think that in terms of the regulation, we're very fortunate to have an environment in which regulation is forward-looking, and the opportunity is for us to continue to take advantage of that regulatory environment and push the boundaries. Now, if we think about what is required to do that, in my mind, there are three imperatives. and they've been touched upon in the previous panel. Dr. Haber talked about that as well. So let's talk about the first one. That is the data imperative. And yes, I completely agree with Dr. George. It is the imperative of the data being of excellent quality, the quality, reliability, integrity, and trustworthiness of data is hugely important. To borrow a phrase from generative AI, we sometimes say, if the model begins to go off track, we say it is hallucinating. To borrow that phrase, if we do not have quality data, then we are just hallucinating, thinking that we will have good AI models. We will not. We absolutely need to work on that. But it's not just the quality of data, it is also the representativeness of data. And I say this because at this point in time, a lot of the internationally trained data AI models, are trained on a body of data that is largely from the Western world. If we are to use the models in this part of the world, we need to fine-tune them on data that is representative of the population here. That is a huge challenge. That is a data gap that exists for this part of the world. It is acknowledged. We need to do a lot of work on that. So that is the data imperative. The second imperative is the talent or capability imperative. It is the talent and capability of individuals, of systems. It is not just the technical capability, it is also the healthcare providers, the physicians, them getting an understanding of where what the models and what AI models are telling us works and what are the guardrails. So it is a broad capability question. But the third imperative is actually the most important one. To me, it is the trust imperative. How do we build trust in that? Just before this, we were having a conversation around the fact that healthcare professionals may have been trained in a completely different era. Now we're asking them to work with these modern advances, with these technologies. We need to help them build trust in the tools that we're putting in front of them. My father was an orthopedic surgeon, so I can say this with, I'll take the liberty of saying that. He would always tell me, yes, but in healthcare, before I incorporate anything into my medical practice, I need to see a lot of evidence. And the point is, I think in healthcare, wanting to see a lot of that evidence before moving is a very good thing, because patient safety is first and foremost. It may be different for other industries. We were just talking about the fact that gaming industry may be, the risk barrier or the risk level can be much higher. But in healthcare, we need to be cognizant of the work and build confidence. So that's why building on that or responding to that trust imperative is really, really important, so that we build confidence in the ecosystem to take advantage of these advancements.
Great. And they're signaling that we're running out of time. Thank you so much for this exciting discussion. A lot of insights, a lot of information. Any final thoughts, Dr. Haber, before we leave the stage?
No, thank you again for having me. I just want to just emphasize what was just said, the importance of training the AI model on local data. And to give you an example, we did develop an AI model to predict antibiotic resistance in the US, in Ohio. However, we know that in this area of the world, people have more tendency to take antibiotics. If we don't train this model on this population, the model will be incorrect. And in medicine, when we take care of patients, a model cannot hallucinate. It can hallucinate when you drive a car and it can break, but in medicine, we cannot, the model hallucinated, we gave you the wrong antibiotics and now the patient is not doing well. We cannot afford those things. So it is important to have accurate data, train it on local model to come up with something that is accurate, that really helps patients. I just want to make one more point. A lot of people are worried about AI, robotics. I think this is a gift to medicine. And the reason why, it is going to allow physicians to focus on providing compassionate care. Right now, physicians are worried about how to predict certain things. Thank you. Thank you, and this is something that is very important to us because we are asking a lot from our physicians. And the science is changing so much, and they have to stay up to date, which what happened, we lose focus on the patient, and we lose focus why we went into medicine. And I'm a big believer that with AI and robotics, physicians are going to become physicians again and provide really compassionate care. So
very well said, Dr. Haber. AI is a gift to medicine. Thank you very much. Rizwan, any final thoughts before we close?
No, I think Dr. Huber summed it up beautifully. I think that this is absolutely an opportunity. It is up to us to help people understand what an amazing opportunity it presents for better health, for longevity. So it's up to us, people who are in this industry, to build that trust in our broader community. But the opportunity is amazing.
Perfect. Thank you very much, both of you.
Thank you.
Thank you. Have a good one.